Hello, and welcome to our Kinetics in Practice assignment. In this assignment, we were asked to focus on trunk flexion. In this video, you will see 3 different exercises, including 1 closed chain exercise, the plank, and 2 open chain exercises, leg lifts and sit-ups. In each exercise, you will see a free body diagram analysis at a certain point in the exercise in the form of a freeze frame. Additionally, you will also see how to make the exercise more difficult, as well as modifications for the exercise for patients with soft tissue injuries and joint pathologies such as osteoarthritis. We hope you enjoy.
When instructing your patient to get into a starting position for a plank, you should have them get down on their knees, and then as they lean forward, this involves placing their forearms on the ground, pressing them into the floor to engage the back, not allowing their shoulders to drop, and while maintaining their look forward, not staring down at the ground. For their lower body, their legs should be extended, and they're placing their foot down while trying to remain on their toes or the balls of their feet. Be sure to engage their lower extremity by squeezing their glutes and quads to maintain their body in a low, straight line. When in this position, maintain their breathing to keep core engaged and supported. They should be able to hold the position until form starts to give while maintaining consistent breathing to keep the core tight. Moving on to the free body diagram for a plank. First, let's analyze the osteokinematics and arthrokinematics of the plank. When analyzing the osteokinematics of the plank, extending the legs to get into the starting position involves extension of the femur about the femoral acetabular joint, about a medial and lateral axis since the motion is occurring in a sagittal plane. When analyzing the arthrokinematics of the plank, flexing the trunk down to the starting position involves the concave acetabulum rolling and gliding anteriorly on the convex femur to set hips into the proper position. Now looking at the forces present in the free body diagram, the segment of interest is the foot, leg, and torso segment. The internal forces present are the muscle force from the abdominals occurring up along the abs/core, the joint reaction force of the torso down in an equal and opposite direction of the muscle force going down the torso and legs. The external forces present is gravity acting on the body, trying to pull the body down through its center of mass, and lastly, the force of the humerus on the torso, since the humerus is touching the segment in order to stabilize the upper body and remain in proper position. Torque is the highest as you are first getting into the plank as your body is closest to the ground. The moment arm will be largest at this moment, generating the most torque. The torque is at the least before the exercise begins, and also once you leave the main position at the end of the exercise. A plank is an example of a second-class lever. In order to modify a plank for a patient with osteoarthritis, the patient could put their knees on the ground to reduce the amount of compression occurring about the abdominals and hip joint. In order to modify a plank for a patient with a soft tissue injury to reduce shear, you could instruct the patient to do a straight arm plank to take the patient off their elbows. This reduces the shear by decreasing the moment arm, therefore causing less shear force and torque to be produced in this moment. Lastly, as we look to progress this exercise, you can make the plank more difficult for your patient by adding weight to their back. This increases the total load/resistance the patient experiences passing through their center of mass. The addition of this weight not only increases the force of the gravity and resistance force down towards the ground, but also the result of the muscle force and joint reaction force increasing in proportion to maintain the body in the proper position.
Here's just a summary slide over our plank.
For our next exercise, we are doing supine leg lifts. In order to do this exercise correctly, the starting position is lying on your back with your legs straight and together, arms at your side. Engage your core and abdominal muscles by pressing your lower back into the ground as if doing a posterior pelvic tilt. If needed, you can press your arms into the ground for additional support. Overall, you should still be able to breathe throughout the whole movement. As you engage your core, lift your legs upward until you feel your back starting to lose contact with the ground. Begin to lower your legs until it is just above the ground. Then repeat the same movement, ensuring to engage your core throughout the whole exercise. Before we dive into the free body diagram, in the snapshot, we are assuming that the motion is in a single plane to do a 2D analysis. We are also assuming the segment is rigid with no deformations and only one muscle force is being considered, which is composed into one force vector. Finally, we are assuming all forces and torques are summed to zero, therefore assuming static equilibrium. Now, with all assumptions in mind, when looking at the free body diagram, the segment of interest we are analyzing is from hip to ankle. The internal forces acting on the hip-ankle segment are the muscle forces from the abdominal and rectus femoris muscles, which are colored in red, and the joint reaction force, colored in green. The external forces acting on the hip-ankle segment are gravity acting on the segment body weight, colored in light blue, and the ground reaction force, colored in dark blue. This creates a third-class lever with the muscle force in the middle between the axis of rotation and the resistance force, which is very common for the human body. The osteokinematics and arthrokinematics for the leg lift describe flexion of the femur on the acetabulum within the hip joint along an anterior-posterior axis, with the femur rolling anteriorly and gliding posteriorly. The XY reference frame has the x-axis parallel along the hip-ankle segment and the y-axis perpendicular. The force of gravity is acting downward, perpendicular to and towards the ground. The point of application from which the force originates is the center of mass of the hip-ankle segment. The moment arm would be the distance from the center of mass of the segment to the axis of rotation. The ground reaction force is an equal and opposite force exerted by the ground on the body. The point of application would be where the body comes into contact with the ground, which, in this case, is the axis of rotation. The direction of force is perpendicular to the ground, extending upward. The force of the muscle represents the total force generated by the abdominal and rectus femoris muscles along the same direction of pull of the muscle fibers. The point of application for the muscle force is just shy of the axis of rotation, creating a smaller moment arm closer to the axis of rotation compared to the force of gravity. Finally, the joint reaction force is drawn in the opposite direction of the muscle force, since when the femur pushes on the hip will push back with an equal and opposite force. The main forces contributing to torque are the force of gravity and the muscle force. Since the muscle force has its y component in the positive direction, it will generate a clockwise negative torque. On the other hand, the force of gravity has its y component in the negative direction and will generate a counterclockwise positive torque. Since the muscle force has a smaller moment arm compared to the force of gravity, a larger muscle force is needed in order to generate a negative clockwise torque and bring the hip-ankle segment up. In this case, torque is lowest when the legs are parallel to the floor or perpendicular to the floor due to shifts in the center of mass. On the other hand, the torque is greatest at a 45-degree angle in relation to the ground, since that is the point where the moment arm is longest. Other than torque to consider, we also have compression forces coming from the X components of the muscle force and force of gravity pushing into the hip joint capsule. Finally, there are shear forces coming from the Y component of the force of gravity. When thinking about the clinical application of this exercise, in order to make the exercise more difficult, one can add ankle weights. The increase in weight will shift the center of mass to be further from the axis of rotation. Therefore, it will produce a longer moment arm and larger force of gravity, which will require a larger muscle force in order to generate a negative clockwise torque and bring the hip-ankle segment up. V-ups are another alternative to make the exercise more difficult, since it requires one to simultaneously lift your legs and arms off the ground. This requires more activation of the muscle force due to the increase in weight, as well as the need for balance in order to coordinate the movement. If the client has arthritis and we want to decrease the compressive forces, we would adjust by bending the knees. Bending the knees will make the segment of interest shorter and bring the center of mass closer to the axis of rotation. Therefore, this will decrease the x component for the force of gravity, creating a smaller resistance force. Finally, for a client that has a soft tissue injury and wants to minimize shear forces, start with the legs at an incline. The client would be able to complete the motion within a range where the center of mass is moving closer to the axis of rotation. The moment arm of the force of gravity would be decreasing. Therefore, the y component contributing to the shear force would also be decreasing, while still maintaining activation of the muscle force.
This is the summary slide for the leg lift exercise.
The next type of exercise is the sit-up. This exercise is done by starting laying on your back with legs bent and soles of the feet fully on the ground. Hand placement depends on how intense you want the workout to be, with the arms behind the head as more intense due to the larger moment arm for moving the center of gravity further up the torso. You want to then engage your core by pushing your lower back into the ground and keeping eye contact straight towards the ceiling. While tensing your abdominal muscles, lift yourself up by bringing your chest towards your knees. Make sure to maintain proper body alignment by keeping your chin tucked in. Be sure to keep the core engaged as you bring your torso back down. Repeat this for the desired numbers of reps and sets. Here we see the free body diagram for a sit-up. The segment examined is the trunk going through the hip. An external force of gravity and body weight is pointed downwards from the torso. A reactive internal muscle force from the abdominal muscles is counteracting this force. At the hip joint, a compressive internal joint force is moving towards the hip joint, while the ground reaction force is moving up away from the ground. In this activity, the segment of interest is your trunk. This is also a third-class lever. In terms of osteokinematics, there is a flexion of the spine along the sagittal plane and around the medial-lateral axis. In terms of arthrokinematics, there is an anterior roll and anterior slide of the pelvis, since it is a concave surface moving about a convex surface. In this motion, the lowest torque is when the trunk is either parallel or perpendicular to the ground, while the highest torque is when the trunk is 45 degrees in relation to the ground. To increase the difficulty of the exercise, a person can add a weight in their hands while performing the sit-up, move their arms higher or further, or incline their torso. To reduce shear during a sit-up, a person can place their hands behind their head, by their side, or across their chest. To make this exercise easier for those with arthritis, a person can do a crunch instead of a sit-up, or they can lift their legs up off the ground.
And this is just a summary slide for our sit-up exercise. And that's it. Thank you so much for watching.